So, good evening. I am so delighted to have as my very special guest this evening Dr. Christine Fruhauf. And Dr. Fruhauf is a professor at Colorado State University. She'll tell you a little bit more about herself. But right now, I just want to make sure that we are sharing this issue that, and like I said earlier, something that I found out about as I've started exploring this whole field of grandmas and found some phenomenal people who are doing some fantastic things out there. And the more I find, the more I dig, the more I explore, the more I find out. And I'm just so excited about this because I clearly had no idea that there were some grandmas that were out there raising grandchildren. I knew there were a few, but I had no idea about the numbers. So Dr. Christian is going to share some of that information with us. She is a researcher and she's going to share some of her research that she's found. Maybe there's some ways that we can help. I know that this week we've been talking about, for the last couple of weeks, we've been talking about this evening of giving. And the idea behind this is that we as grandmas and the grandma community can help support our peers, and our peers being those grandmas that are raising their grandchildren. They're known as grand families. Now, sometimes there's a grandpa on the scene, sometimes there's not. But I think it's really important that we lend a helping hand to these grand families, and especially now, because I feel like I don't have any research to back this up. This is just my own feelings that these are probably the most challenging time during the holiday season, and then maybe back to school. Probably the two most challenging times, of the year for grand families. So I thought that it would be a great idea for us to do some fundraising in our own way, and the way that we're doing that, here's how it works for us. So we ask the membership fee of our members for Grandmas 2.0, and we have ranges from $50 a year up to $500 a year. And of course, each package is a little differently. But whatever package you choose, you will have an opportunity to half of whatever package you choose will go towards some grand families that we're going to support. So we're doing this every Tuesday evening, 7:30 to 8:30. We're going to come online. Last week, I think I did it on Facebook. This week, we're doing Zoom. We're going to post it on our website because we want everybody to hear, all of our followers. And what we're doing is we're going to donate half of whatever package a grandma chooses. We're going to donate that money to grand families. And so we are asking you to support us, to lend a helping hand, because we need your support as well as, to help support them. So that's how it works. So please feel free to join. You pick the package that works for you, and then we will donate half of that to some grand families. I'm hoping there'll be more than two, but I don't want to make any promises that I cannot keep. So I want to make sure that we say at least two, and then we'll see how many others. Now, there's so many other populations out there that need support as well. But since we are focusing on grandmas, I thought it was appropriate that we looked and figure out ways that we can support grand families. So again, it's my pleasure to introduce Dr. Fruhauf, Dr. Christine Fruhauf, and she will tell you about herself, her work that she's doing, and the work in this area of kinship caregivers, grand families, Generations United, and all of the above, okay? And some of her research. So thank you, Dr. Christine, for being on with me tonight. I really appreciate it. And I'm going to turn it over to you.
Sure. Yeah. Thank you for having me. It was exciting to talk to you briefly a couple of weeks ago, and to be invited to be part of this evening of giving. I'm happy and delighted to see that your organization is going to support grand families, because we know, you're right, grand families are certainly a population that has several needs. And in addition to needs, though, they also have strengths. And so we can certainly talk about the needs, but I can also share a bit about what I've learned over the years, thinking about the strengths and the resiliency and the resourcefulness of our grand families that we work with. But yeah, I actually started, it was 1997. Well, 1996, really. Almost, how long is it? Almost 30 years ago, just shy of 30 years. Yeah, when I was an undergraduate at Ohio State University, in Grandfamilies, and particularly at that time, I was on a research team, I was an undergraduate research assistant, that was looking at data that we collected in the Columbus, Ohio area with grandparents who are raising grandchildren about the role conflict that they experience. So, Dr.
Ooh,
Marcia, as you talk about, right, the grandmas 2.0, not being these sit home, bake cookies and, just play with grandkids, grandmas are out and about and doing things and working full time and having fun and
yes.
enjoying life. And so
As
many.
they say, as the kids say, we outside. We are out.
Right. Yeah. And then when grandmas or grandfathers are faced with, a grandchild whose parent, for whatever reason, is no longer able to parent or no longer willing to parent, for a number of reasons, and we can certainly talk about the reasons that we typically see. Grandparents oftentimes go through some grief and loss, and perhaps have some experiences related to role conflict, where they may want to be that fun-loving grandparents, that traditional grandparent, where they play with the grandchild, send that grandchild home with their parents, but now are no longer able to do that because they are now the primary caregiver and the person responsible for caregiving. So, 27 years ago, I was involved in research, exploring that, and the research today has moved, forward. I would say, over the 27 years, I've been pretty active in wanting to understand how, raising grandchildren, being the primary caregiver, or sometimes we call custodial grandparent. You'll see that in the literature. That's usually when there is some legal arrangement. Maybe there's a custody arrangement. Maybe there's allocation of parental rights or guardianship that states that the grandparent now is responsible for that grandchild. But when in those cases, what we tend to see is our custodial grandparents or grandparents who are raising grandchildren when no parent is present have poor physical health, more chronic diseases and illnesses, higher rates of depressive symptoms than their grandparents' peers that are not raising grandchildren.
Mm.
And so that's been a real concern of mine, over the last, I would say, 12 years, 15 years of being an academic at Colorado State University, and was able to get involved very quickly since I started here, working with community organizations to help provide services that might decrease any of those negative impacts on grandfamilies. And so, with that, that experience, what I really and wholeheartedly learned, through not only my research, and we can talk a little bit more about that, but I think more importantly, the work I do with community members and community agencies, is how important resources, services, providers, even grandparents are to one another. And when we can work within coalitions or alliances or networks where we can pool resources, and whether that be financial dollars or that just be brain power or hands, right, to help to support grandparents, we can do a lot of really good work. And with that, I had been involved with and really helped co-create. I can't take full credit for this work, but it was in 2007 when the Larimer County Alliance for Grandfamilies formed. And Larimer County is the county to which Colorado State University's main campus sits.
Okay.
Yeah, into which we're about an hour north of Denver, and so got very involved. Because 3 grandparents knocked on the doors of various service agencies who all said, we know grandfamilies are important to our communities. You're doing a lot of hard work, but our agency alone just can't support you. And so it wasn't until they came to Colorado State University Larimer County Extension Office, which for the land grant institutions, we have these satellite offices or extension offices that really help support communities through programs and services. It wasn't until they knocked on the door of our extension office that our extension a faculty member at the time said, well, I can't necessarily help you, but I know how to bring people together, and let me bring people together. And so since March of 2007, we've met monthly. I mean, it's hard to believe it's 2023. We've met monthly. We've done a number of things. We've received several grants that have helped support grand families. There's been new nonprofits that have been started because of the work. And that's, I think, how you met Gail Engel of Grand Family Coalition.
Yes, that's incredible.
Yeah. So she's a great partner of mine. So, I think together, as service providers, community members, community partners can really help benefit and meet the needs of grand families. So yeah, I'm trying to think, I guess I can share one project that I was pretty proud of, and still I'm pretty proud of. My colleagues and I here at Colorado State University, as well at the University of Hawaii at Manoa, received a 5-year USDA NIFA grant to create and implement and test a intervention for grandparents and the grandchildren that they're raising in their homes. In addition, our other objective was to create informative videos, very short videos for service providers, and then to help them just understand a little bit more about grand families. And that was because so much of not only our own work that we had collected, but work of our colleagues across the nation who have said, service providers, case managers, social workers often work with grand families, but they don't necessarily really understand all the unique needs that grand families may face. And so that was our the rationale why we wanted to also create these short webinars focusing on really the strengths of grand families. And so
that's a pretty exciting work. When you think about it. Now, I worked my first real job as a professional was with the extension service.
Oh, I didn't know that. Okay.
What I used to do. I used to do parenting. Actually, it wasn't called parenting, but that's really what it was. It was, we would go, remember the FNF program?
Yes. We still have that in Colorado. Really? Yeah.
So I was in North Carolina, and we had a pilot program. The FNF was already there, and it was the consumer, consumer sciences or something, services or something like that. Yes. And my job was to go out to these homes and talk with parents about, their children and get a focus on child development kinds of issues. Because my degree is in child and family development. Okay. And so it was so funny because the parents would say, I was maybe 23, maybe.
I know where you're.
Do you have children? No, ma'am. And they say, well, how are you going to tell me how to raise my children? I said, well, I'm not telling you how to raise them. What I'm telling you is what the research says. Yes. Right. Yes. And so maybe we can have a meeting of the minds based on what the research says, what you actually do. So I had to figure out a way to gain some credibility with them, because they're like, little girl.
I mean, I would get the same thing. And yet at the same time, it was like, what do you know about grandchildren? Right.
Oh, yeah, I can see that. What do you know about grandchildren? Right?
Yeah.
I mean, like 10? Right. But that was a wonderful experience. I loved that agency.
Well, and I'll tell you, not only through like our cooperative, our extension work, but spending 16 years with the Larimer County Alliance for Grand Families, I would say the grandparents, and a key factor to, I think, any network or alliance or coalition when you're trying to serve a population is to include the individuals that you're serving at the table, right? They're also the decision makers. And so our grandparents they really are the cheerleaders and the champions, and they're the ones telling me, Christine, you might read that in the researcher's next steps of the empirical articles you're reading, but what we really need you to do is this. And
Right.
so I will tell you that really much of the kind of idea and the framing of that project that I shared with you really came from the grandparents that we talked to and that
Mhm.
alliance that
Mhm.
I had worked so closely with.
Mhm.
And so cooperative extension is a great entity, and I have grown with our CSU cooperative extension over the years. I don't have a formal appointment with them. I just kind of
Mhm.
like to collaborate as needed. And
Mhm.
we're trying to
Mhm.
take more of a healthy aging approach with them these days. We
Mhm.
do a little bit less in the parenting realm,
Okay.
but yeah, but I'll tell you, so like the grant that we had, what we discovered is that um from a 6-week self-care intervention. Now, we worked very closely with the owners and operators of an evidence-based program called Powerful Tools for Caregivers, which
Hmm.
is a chronic disease self-management education program, but really focusing on meeting the needs of caregivers. We
I'm
worked with
gonna
them
put that
to,
in there. Do a hashtag for them and kind of
yeah,
what is it called? Powerful
Powerful Tools for Caregivers.
tools for caregivers. Okay.
Yeah, and it's now owned and operated out of Iowa State University. So there's just a great organization. Um, but we worked with them, and what we discovered is that grandparents, they showed significant improvement in caregiver self-efficacy. They showed significant improvement in or significant decreases in depressive symptoms from
Hmm.
baseline to post assessments. So just like, and for me, what that says to me is not only do grandparents come and attend these sessions, but they work hard and they can make a positive change in their overall health and wellness. And I
Hmm.
think that's something that we, as researchers and as perhaps clinicians or providers or grandparents who are wanting to give, will
Hmm.
recognize that with some extra support and guidance and perhaps interventions, grandparents can make some improvements
Oh yeah.
in their lives. And so that to me is just the piece that I appreciate the most and really welcomed hearing and working with the grandfamilies on that
Hmm.
project.
And this summer, I had the pleasure of doing a keynote
Oh,
speaking engagement with Department of Health and Department of Health and Human Services, Georgia State Department of Health and Human Services.
okay.
And oh my God, I learned about the kinship caregiver
Project
navigation.
Healthy. Oh, okay. Okay.
Yes, the
Okay.
navigation system, but that
Yep.
I didn't know about. So again,
Yep.
like I'm saying, I'm learning so much about grandmas as I do this work,
Yep.
but I'm also learning about, that there are grandmas out there that are not really having a good time, but they're at home taking care of, other folks and children and doing parenting second time around and all that. And I'm like, wow,
Yeah.
I had no idea. But there are some resources out there. But I would suspect, just like any other population, what we refer to in early childhood as vulnerable populations,
Mm-hmm.
there's not
Mm-hmm.
enough resources to go around.
Correct. Yep. And I agree. I think you're right. So kinship navigators is the term
Hmm.
that we tend to use, that
Hmm.
you'll find oftentimes associated with the Department of Children and Family Services or
Right.
Department of Health and Family Services, depending on what
Hmm.
county or state office they name that. And those kinship navigators have been really instrumental in helping, particularly what they say, the non-certified or the informal
Uh-huh.
grandparents who might
Okay.
be providing care. If
Okay.
Yeah, you can be, and this is where, because I'm not a social worker, I'm not a case manager, and I have no degrees in that area. So
Hmm.
this is where it's just been learning from others, is that there's certified kinship care providers and then there's uncertified, right? And so
Uh-huh.
individuals who are raising kin, so grandchildren or nieces,
Hmm.
nephews, perhaps even
Hmm.
siblings, they can go through what DHS will offer as a certification to be a kinship provider. And I think with that, right, I don't know exactly the length of training. I
Hmm.
think though that allows that person who's certified to receive some additional support dollars If you don't go through that, which I would say more often than not, grandparents often do not go through that certification. Then they don't receive those additional dollar amounts, and so then that could just be a hardship in and of itself.
Yes.
And I know that there's been some legislative changes to try to make make some policies be a little bit different, because we know that grandparents may need those financial dollars, but don't want to go through the training because they don't want necessarily DHS to know that they're raising grandchildren, or they don't want, them to be on the radar.
Right.
And that, I would say, is also just kind of decreasing any stigma about working with DHS, right? That's one of the things that our alliance has done, and realized very early on, is that grandparents didn't even want to walk into the building because they were afraid of something, right? And so just that was one thing that we worked really hard at, trying to decrease any of that stigma for receiving help. But you're right, grandparents certainly could use some additional supports. And there's a variety too, right? I think one of the things we've said, and we've, not as from my colleagues who are researchers in this area, but also my community members, is when you've met one grand family, you've met one grand family, right? Every grand family is so unique and different, and their challenges and their strengths are very different. So I think that's something just to keep in mind for your listeners, yeah, and your members.
Yeah, I can see that, because so there's some families that are, both grandma and grandpa. There's some families that are mainly just grandmas. There's some, I'm assuming, that are grandpas. Would you say that most are, when it's the grand family, that most grandmas?
Yes.
That's what I thought too.
Yes. Okay. Yep. That is correct. I would say, the percent, and I don't know the percentage off the top of my head, how of these skip generation families, how many are led by grandmothers, but I can say with my own research and with the research that I read nationally, it's mainly grandmothers. We grandfathers are a little bit harder to find, even just to have them participate in research. But as far as numbers go, you're absolutely correct.
Yeah. And I was astounded at the number of grand families. So I read one thing from Generations United. I think it was probably 2020, 2021 data, but it said there are at least 2.4 million children growing up in grand families in the US today.
Yes. It's a lot. Yeah. And I think the estimates suggest it's about 10% of children are raised by a grandparent. Now, I was just at a conference a few weeks ago, and I think somebody had said they think that number maybe has gone up to about 12% now. There's some speculation that it's gone up, particularly because of impacts related to COVID-19 and the the deaths that were associated from that.
Now, let me ask this, Christine. Do you know if there is a collaboration with the Office of Head Start for grandparents?
It's such a great question. I don't know if there's a formal collaboration between, any federal agency or even, nonprofits like Generations United and Head Start. I can just tell you that I know, I think, at least from my own grant, my colleagues in Hawaii, they had a lot of success working with Head Start to their Head Start system in Hawaii, to recruit grandparents, but to also just, provide resources to Head Start for when Head Start was serving grand families. But to answer that question from a national standpoint, I don't know of any formal relationship with that. If there is any, it might be more informal.
Right, because I know that I used to work for it was an agency that had a contract with the Office of Head Start. And we would put content online for the early childhood providers, across the country. And mainly it was for Head Start, but any early childhood person could access the the repository, the online system that we had. And we
Mm.
would put a lot, just lots of different information that would help the teachers, help the directors.
Yeah.
And I remember at one time there was a specific, and I don't know if it was an agency that was under AC, so it's Health and Human Services, and then ACF,
CL. Oh,
Administration for
okay.
Human
Yeah.
Families, and then under that link, under that category or office, there was Office of Head Start, Office of Family Assistance, and I think at one point there might have been a collaboration with those two, and they did
Okay.
something with grandparents that were raising their grandchildren. And I
Okay.
don't know what happened. I don't know if it went away, it just no longer
Okay.
exists. I don't really know, but I wondered about that since I've been doing this work, of course. Of course, then,
Yeah.
I knew that it existed, but I didn't know, I didn't know who necessarily who funded it or whatever. But now,
Right.
because it seems to be more prevalent, the numbers have gone up. Because that was, when was I there? 2010. So that, you see, that's been like 13 years ago, 10, 13 years ago.
Yeah.
So I'm wondering, so is there any program are they doing that? Are they collaborating? Is that it? Seems like
I
that's something that needs to be done at the
I
national level.
know. The only thing I know over the last few years, the Administration for Community Living,
Mm-hmm.
they've had a task force, one for grand families and then one for family caregivers. So they've kind of
Mm-hmm.
almost operated similarly, but separate, right? Because obviously we
Mm-hmm.
know, right, you're providing care for a grandchild versus providing a care to an older family member who might have a chronic illness, right?
Right, right, right. Yes.
So the Administration for Community Living has been pretty powerful in setting priorities, and those are like national priorities, right?
Mm-hmm.
For administration on aging, to state units on aging, to county offices to focus on grand families. And in addition, one of the things that well, what I could tell you is through those partnerships, they have partnered with a number of entities, and I think and some of them I know pretty well and others I don't know that well, but US Aging is one, the National Caucus and Center on Black Aging, the National Indian Child Welfare
Mm-hmm.
Association, 0 to 3,
Oh, yes,
and
I'm familiar.
child trends. And so that 0
Mm-hmm.
to 3 and child trends could maybe have an association with Head Start. I don't necessarily know. Again, this
Well,
is
they do, but I don't
not
ever
my
yeah, I don't ever hear them talking too much. Like I don't know them personally necessarily,
yeah.
but I
Yeah.
read a lot of their information because of the classes that I teach.
Okay. Okay.
And my field is early childhood, so I'm always looking
Uh-huh.
for information about early childhood, information about parenting, but
Uh-huh.
rarely do I see anything about grandparents raising grandkids. And I did see that on the 0 to 3 website,
Okay.
but
Yeah.
if you didn't know better, I mean, it's like it's hidden
Right.
somewhere. It's
And
not.
it might not be a main priority for them,
Yes,
right?
yes,
It might be
yes.
just a partnership.
Mm-hmm,
Um,
mm-hmm.
and then one other thing, and I think, you probably already know this, that through this focus, or this national, I think they were calling it a National Council for Grand Families,
Mm.
they did award Generations United a pretty large grant. It was a 5-year project grant, almost $10 million, to
Well,
be
excellent.
to be the National Technical Assistance Center on Grand Families and Kinship
Mm.
Families. So I would say Generations United really is a national leader that supports
Mm-hmm,
grand families,
mm-hmm,
and they're certainly recognized by the federal government in
mm-hmm.
that space.
Okay, okay.
So yeah, and I don't know if maybe Generations United has any direct connection with Head Start. I've attended and presented at their conferences, but I don't remember Head Start necessarily being there.
Mm.
So
But I would think because back in the day when we were doing that work, I wasn't doing it, personally. Someone else on our team was, and there were a lot of children at that time being raised by grandparents.
Yep.
But by now, that number, I'm sure, has increased,
Yep.
with the state of affairs that we're living in
Yes.
right now.
Yep.
And so I'm wondering, I'm like, wonder why that's not an issue or a priority anymore. At one point, it was a priority,
Mm-hmm.
but now
Mm-hmm.
it's not necessary. I don't think it's a priority. So
Yeah. There might
that's
be
what
other,
concerns me. Yeah. And I'm like,
yeah,
wonder why that's not
priorities.
a priority, because it is definitely something that we need to focus on, because
Yeah.
there's so many young children that, like in the child care centers. I even do a module on well, not grandparents, but grandparents raising their grandchildren. And I was asked to do a workshop one time, and then when I started doing my research, that's when I found out about all of this. I'm like, oh my God, I had no idea that all of this was going on out there. I would guess I was
Right.
oblivious to it, because, like I said, when it was popular, you know, then we talked about it. But then now is something happening, we're not talking about it anymore in Head Start. And I do a lot of work around Head Start, and a lot of my teachers that I work with are either in Head Start,
Yeah.
regular early childhood programs, or
Yeah.
public schools, for pre-K.
Well, maybe this, new interest in discovery of grand families for you could spur some additional collaborations with Head Start, or,
Yeah, yeah,
just
definitely.
inquire.
Yeah, definitely. I want to start talking about to my friends that are there.
Yeah.
What's going on? Is anybody looking at this issue? That sort of thing,
Yeah.
just to
Yeah.
kind of see. But
Yeah.
when you were talking about, the grassroots efforts that you guys did, and that
Yeah.
question came to mind. Well, what about Head Start? Were they at the table with you?
Head Start really wasn't. We did have, our county has an early childhood education coalition, and they're represented. They're at our table. It took us years, and when I say years, it took us almost 10 years to get our two local school districts represented and at the table. That was
Mm-hmm.
really hard. To really bring them on, and to get them to engage monthly,
Right.
and then it was like,
Right.
once they were there, they was like opened up so many opportunities and avenues for us to connect with the grandparents that the schools reach.
Yeah, and do the
um,
schools, that's another question that I had. Are the schools really focusing on grand families?
I would say, at least in Northern Colorado, the two
Hmm.
school systems that I work closely with, they are fully aware of the needs and the challenges and some of the strengths that our grand families experience. And
Mm,
for particular, I would say, not only are there, like, we have some, I forget what they're called, but like family program and kind of like life enrichment
right. Okay.
care managers with the schools. Not only are
Uh-huh.
they aware, but some of the principals and even the superintendents have hosted our
Yes.
coalition for grand families, and have had kind of information sessions at their schools, which was with administrators, which was just great. So that was a great way for us to connect. Yeah.
Yes, yes, yes.
Yeah.
Because I went to a back to school event this past August, and met a lot of grandmas raising their grandchildren at this event. I was
Yeah.
floored, and this was
Yeah.
locally. And
Yeah.
so I started, I tried to get it, I tried to talk with the principal who was there representing one of the schools, not all the schools, but one of the schools, to ask her if they were doing anything, just out of curiosity. Are you guys doing anything specifically for those families? I said, because there are a lot of families. And I had said I had no idea how many there were until I came to this event. And I was talking to them about, grandmas in my program. I said, and
Right.
they were enlightening me about their own situations. And I'm like, wow. So, and so she said, no, we don't really separate them out, as if that was a bad,
Yeah. Yeah.
you
No,
know.
and I love that. Like this. So I'll tell you some of the work that we did on that project that I was sharing. One of the things that we learned working with our grand families is that oftentimes grandparents experience microaggressions, and
Mm.
they would talk about how challenging it was to get letters from the school that said, "Dear parent," And they're like, but I'm not the parent, right? Just even
right.
hearing that can bring up grief, can bring up loss, can bring up just hosts of other feelings, anger.
Yes.
And so my colleagues and I, we actually spent some time really kind of unpacking what, what grandparents may hear, what we've heard when we even conduct community meetings. I still remember to this day, at a community meeting, had an outside person kind of come and present and talk, which was great. This person really wanted to engage. And then, at the end of her presentation said, just want to say to all the grandparents, like, I recognize what you're doing. My mom, this is what she says, my mom watches my son 2 hours a day because I know what a toll it takes on her. And I was like, I don't think you know. It's totally different. And I just remember like some of the grandparents' smoke was probably coming out of their ears. And I was like, just that in and of itself is so different. Right. I get she was trying to connect, but that right there was also just a microaggression. Like, it's just like, this is different. This is not babysitting. This is not 2 hours a day. This
exactly. Yeah. I
so
commend them. I commend anyone who has the courage to do that, because I know for me at this point in my life, that's not what I want to focus on. Now, if I have to, I would.
Right.
I would step in because I love my grandchildren.
Yeah.
But I wouldn't want to. And so I commend anyone who's doing that, because that, I recall parenting and how it was of your young children. It's a full-time job. It is not an easy task.
No.
And to do that a second time around, or to be willing to do that, it takes a special person to do that.
Right. It does.
Everybody would not do it. Yes.
No, and that's it. I think, I will tell you, most of my research, and even I think my colleagues across the nation will say, when they're talking with grandparents and if they're doing, those qualitative in-depth interviews, most grandparents will say, this isn't what I wanted. And yet I'm so grateful I'm the one. Not all will say that, but I'm so grateful I'm the one to provide this care. And again, not all, there's, but it's interesting, right? And I wonder, what I don't know, and this is maybe a new research, like a future research project, what is the trajectory? What is the grand family trajectory over time? Like, how do grandparents kind of ebb and flow in their thoughts on raising grandchildren, or their identities, as you think about grandma's 2.0, right? Like, how in thinking maybe, what is my self-identity as being a grandparent, and how does that change or evolve over time? And then what does that mean when I'm a grandparent raising a grandchild? I don't know, right? Like, I don't, that work is I think, has not been explored, because we've always been so focused on, well, what do grandparents need? And what are their strengths, right? And how are they resourceful? Nobody's really just looked at, well, what is their identity, and how does that impact their quality of life? I don't know.
Right. Because I could see that being a challenge. I read something about the mental health challenges that the children experience for being, away from their biological parents, for example, and sometimes abruptly, sometimes, for whatever reason, and then accepting the fact that their parents are no longer in their life. And now, even though it's grandma, and we know grandma and we love grandma, but we love grandma at a distance when she's at her house and she's not, so there is a difference. And this trauma, they all have to get over it, the grandparent as well as the children. Wow. I mean, I just don't know. I would be devastated, I'm sure. But again, would be willing to do it if I needed to.
Right.
I just commend the folks that are doing that, because that has got to be a very challenging time or event in your life, and so I could see the trauma.
For sure.
So it's heartbreaking when you think about it, because not only is it heartbreaking for the children, but it's also heartbreaking for the grandparents who now have to stop
For sure.
whatever path they were on to do something totally different.
Yes.
Yeah.
Yes. Yeah.
And I've read some stories. I want one of the things that I want to do is connect with families and get their stories,
Mm,
because I want to hear, some of those lived experiences that people may be willing to share, because there
right.
are other people who may be about to go through this that don't know what to expect. And yes,
Yep.
you've seen one grandfamily, you've seen one
Right.
grandfamily, but there may be some lessons learned. There may be some things, some gems that they could share that would really benefit some other people who are about to go into this, or who are currently just starting out. That would really,
Right.
yeah, yeah. So that's one of the things that I'm, this work is leading me and calling
It's
me.
good. Yeah, it's pretty exciting. Yeah, I think that's exciting work. I mean, certainly as somebody who's talked with grandparents for the last almost 30 years, there's
Mhm.
a lot that we can learn from each other. So,
Yes, yes,
yeah,
definitely. So, and I just finished my second book, and it was just with grandmas, but not grandmas raising their grandkids. But I want to do one just devoted to that, because I think,
good.
again, their voices need to be heard. And I know there's a lots of programs and organizations that are doing that now. So that's actually how I got to talk with Robin, because I said to her, I really want to talk to some grandparents. And then she started telling me about, folks like yourself and Gail and
Yeah,
Mercedes, and just different people that are kind of leading the charge in this area. And I was like, wow. So
it's good.
yeah, so I'm excited about that, about the possibility there. Oh,
Good.
Christine, I tell you, there's just so much to know, so much
Yeah.
to learn about this. But thank you so much for sharing this information with
It's a,
us tonight. And if you were to leave us with one thought
mm,
about
yeah.
what we could possibly do, or how do we need to look at this, because again, I think it's just like, wow, we're pulling back the curtain on this. We're really
Yeah. I mean, I guess I have two thoughts,
okay.
I think, as you think about supporting grand families, what I've learned is that, um, within those, I mean, I would say really grand families in those first 3 to 6 months, right?
Mhm,
They really are in this
mhm,
crisis mode. It's like they
mhm.
need basic knowledge of all the things, right? Everything from parenting a second time around to um, you know getting a child cover, health insurance coverage, to medical appointment, to all the things, enrolling in school, again, depending on ages, right? So there's these like crisis modes. And then I would say over time. So once things kind of settle down, I think when grandparents can sit back and kind of have those quiet moments, I think that's when they need that additional social support. They need that support on how to really take care of themselves, because
Mhm.
that is when you could just get in the rut of just like, well, I have to meet the needs of my grandchild, and they forget about themselves. So
Yes,
those are
yes.
just two things to think about as you think about,
Mhm,
supporting grand families in the future is,
mhm.
are you going to want to, and maybe you focus on all grand families, but are you going to want to focus on those ones in those first 6 months? Are you going to want to focus on the ones that
Um,
have been, doing this for a while and might need more focus on themselves? So it's just something to think about.
There's something to think about. Yeah, because I never kind of separated the two groups out to think about.
Yeah.
But you're right. The needs, I could see the needs are totally different.
Yeah, and then the needs also change a bit too. If you're finding you have an infant that you're raising,
Mm.
or you're finding you have a 13-year-old, right, that
Oh,
you're raising. So it's, yeah. So then we could get into that even more, but just,
that's right.
thinking about that too.
Yes,
Yeah.
yes.
Yeah.
Wow. This has
Yeah.
really been enlightening, even more so than I even anticipated. Okay.
Well,
Because you're
good.
right. That's a very good point. So I was jotting down some things you said, like the 3 to 6 months. That is there any kind of guidebook? We always say there's no
There's,
parenting handbook. Is there
yeah,
a grandparenting handbook for
there,
raising it?
well, it's funny that you say that. There is, and if I was at my office on campus, I could pick it right off my shelf and show you. There was one that came out, I think it was 2018 or 2019, that was really supposed to be geared towards the grandparent that was raising a grandchild.
Okay.
And I think it's a pretty good book. I can send you the name, the title, and the
Okay.
author by email. I apologize that I don't have it memorized.
Okay, no problem.
Yeah.
Yeah, that would be great because I would love to ask them
Yeah.
to on my podcast as well.
Yeah. Yeah.
Yeah, definitely. And then parenting an infant is one thing, and we know physically challenging and all of that.
Right.
But parenting a teenager, oh my God.
Yes. Yes. Yeah.
No. I have 3 children of my
Okay.
own, and they're all adults now.
Right.
And I'm like, thank you, God, for that. So having to go through that with a teenager again, yeah. But
Right.
you're
I
right, the
know.
needs are totally different. Oh my
Yeah.
God, yeah.
Yeah. Yeah.
Wow. Mm. So thank you again, Christine. I
Yeah, you're
really
welcome.
appreciate you coming on and talking with me. I think I have Robin next week,
Oh,
so she's going to
great.
give us a national perspective, tell us about some of the resources and everything. So that's going to be exciting
Good.
as well. But thank you so much, and please let's stay in touch because I want
Sure.
to have you on the podcast, okay?
Sure.
And
Yeah, it'd be
that's usually
great.
about 30 minutes or so. And I usually do that on a Saturday. So
Okay.
I'll let you know. You tell me which Saturday. We'll give you some dates and you
Sure.
tell me which Saturday, okay?
Sure. Okay, that
Thank you
sounds
so
great.
much.
It
It
was
was
great
great to
talking with
talk to you
you.
again. Bye-bye.
Yeah. Bye. Take care.
Bye. All right, everybody. This was an episode with Dr. Christine Fruhauf, and she is a professor at Colorado State University, and her focus and research interests lie in grand families. So I hope that you were enlightened enough tonight to really make a contribution to Grandma's 2.0 so we can support some of these grand families that are out here. Now, I don't know about you, but I would not want to have to be a grand family. If the situation presents itself, I would have to step up to the plate, but I do not. And I hope and I pray that I do not ever have to do that because that is very challenging. So I'm asking you to open up your hearts to please think about if you were in this situation, what you would need and if you would need someone to help you out. So please, I'm asking you again, I'm going to share with you how it works for Grandma's 2.0. And what we're going to be doing is we're going to, let me share the slide. Give me a second here. We're asking that you purchase a membership from us, and in your membership package, you have a choice of a bronze membership, which is $50 a year, and half of that membership fee will go towards a grand family. Whatever we collect, well, half of whatever we collect in these memberships will go towards a grand family. Whether you get a $99 one, $200 one, or $500 one. And in the process, you also will get some benefits as well, as you can see here on the screen. So again, please, we're asking for your support to help us help grand families of America. Thank you. So this is Dr. Marsha McLean, and I am signing off for Grandma's 2.0. This has been an evening of giving. And next week, our special guest will be Robin Ward, who is a national spokesperson for Generations United, which is a national organization who works with grand families across the U.S. So again, I look forward to our conversation. And again, thank you. And please consider joining Grandma's 2.0. Have a good evening.